Welcome to this edition of In Focus on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of Whitewater Community Television, sitting in the chambers of the Wayne County Annex. This is the Council Commissioners' chambers. You've seen it, the Brady Bunch orange chairs. And we're here with, I'm going to have a little fun. Come on. We need to smile a little bit.
That's what I said. We have to have in this small crisis fun with it at the same time, but we need to take it very, very serious, though.
Yes,
very much
Commissioner
so.
Ken Paust is with us, President of the Wayne County Commissioners. Now, the government, let's just kind of jump into this. You said at a press conference yesterday, and we are recording this on Wednesday following the commissioners meeting, which we urge you to watch the full version of that here on WGTV Channel 11. It will also be available on our YouTube channel for those who don't have that. There are things that you all are grappling with, but you said yesterday in the press conference, government is trying to keep doing what it needs to do for the people.
Right.
One of the things that you all did, and one of the things that you all announced in that press conference, was the fact that there's a travel ban. We're used to them when there's snow falling on the ground.
Right.
We're not used to them when it's sun shining or the skies are just a little bit gray. Talk about what you all consider to be essential travel.
Right.
Because that's an interesting word.
It is. What we did yesterday at 09:30, we declared an emergency and did the necessary paperwork that we have to do, filed that with all the different offices. That went into effect at 09:30 yesterday morning, and it is a level 2, and as you know, we have a level 1, level 2, and a level 3. Level 3 is the most restrictive. If we put that in place, that means you have to stay in place at your home. You do not go out. Only emergency and first responders would be allowed out on the roads at that time. So we did put the level 2 in, and what we are saying to the folks, essential travel only. And I always get that question, what do you mean by essential travel only?
Right.
And I try and answer it this way. Under normal conditions, that would be what you do on a day-to-day basis on there. However, with a level 2 on there, we're asking you to ask yourself, do I really need to leave my home and go do this? If you just want to run down to the store to get a pack of cigarettes or to buy 6 packs of Cokes, do I really need to do that? I already probably have that at home. Do I need to go out? I have food, I can cook, I can stay here at home. One of the big things that was brought out in yesterday's meeting, and you'll see the same thing on the national televisions on there, what we're all working towards is to not have a peak of the COVID-19 virus here in Wayne County. And if you look at that bell curve that we all talk about and you watch the professionals on there, they all want to try and level that out. That if we can get that to happen, then all of our emergency responders and our hospitals will be able to handle those folks that may need to go to the hospital on there and be admitted in there. So that's what we're working on. So as we look at essential travel here, folks think, do I really need to go out today? If you stay at home, we know that this virus is not going to be spread as quickly. So that bell curve comes down, it levels out. So our doctors and our hospitals will be able to handle those cases that come about. So it's really common sense. We can't, at this thing, we're not saying we can make you stay at home. We're asking you to do it now. That doesn't mean if things get a little worse here that we wouldn't put a level 3 in place. But right now at this time, and we have found since we've made the changes here, not only in the city but in the county, that the folks have been participating quite well. As you well know, we have put restrictions on in our annex building here in the county. For essential, we've said that same word again for essential services. But what we're asking, like our realtors and our attorneys and the folks that are in here on a regular basis, or even the individual person that may need some information from the auditor or the assessor, send us an email or send the phone numbers to us, and we will get the answer for you and we'll send it back to you by email, or we'll call you and give you the answer on there that you need. It's not necessary. Again, let's take the plat room for a real estate company that needs some information. Well, they can go into our GIS system and do it there. And if you really felt, I really need this down here, I need to go down and look at the plat book. What we're asking you to do is call Nancy Jackson that's in our plat room. she'll look that information up for you and she'll get it back to you. So you don't have to come in here. Our main goal in this part of government, as well as the city, is to keep our people well and functioning so government can continue to function. As you know, this morning we had a discussion with our highway department of what do we do with that? How do we keep those folks safe out there? Do we split? Do we have 2 shifts on the highway department? Do we take our office staff, we split that into a morning shift and an afternoon shift so that we don't go down? Because there's no guarantee, as you can well see in the last week here, we could have a blizzard tomorrow and all of a sudden we got 6-7 inches of snow. And you well know if we don't get the snow off the streets, we get all kinds of complaints, although maybe that might be good in the fact that everybody'd stay at home and we wouldn't spread this virus on there. So we've done that, and what we are doing in the annex and in the courthouse now, if folks do come in, we are taking temperatures. And the point there is at 99.6. If anybody is over that, we do not allow them into the building. We have had 3 folks that have come in with fevers above that we did not allow in the building. And so they are then away from our staff that we have. For example, our 911 center. Okay, we have limited folks and staff in 911 center. They come in now at 6 o'clock in the morning prior to most of the staff coming to work in the annex building here, and they go home at 6. So they're not congregated in, because we certainly do not want our 911 center to go down, although we do have the capability of going out of the building and even in the back of a truck where we can set up and do dispatching out of that. So we do have a backup for that, but at the same time, if we got one in there and had to quarantine all of our people and they got sick, how do we keep the center up and running to be able to do this dispatch for all the responders? We're working very closely with Mayor Snow and Chief Purcell in the fire department. We're looking at setting up a triage center with them so that first responders, if they did contract a fever or showed the symptom, that we would have a place to isolate them. So they're working on that. I know the chief has bought some beds and stuff, and we'll be coming up with a place of where we could put those folks on that. So it's a changing thing. About every 15, 20 minutes or within a half a day, changes come along is what it is. Even in here, we're looking at, okay, can we continue doing what we're doing at this time, or do we need to take the next step where we may have to just close the courthouse down and say no essential business at all? We're pretty close to that now, where the public has listened to what we've had to say and are not coming here.
Talk a little bit about how you balance and how government has balanced the need for businesses to be able to remain open, particularly some of the smaller businesses that are operating on very small margins with public safety. Talk about that balance for you all, because if we start having businesses shut down, particularly some of the small businesses, downtown Richmond, Hagerstown, Centerville, doesn't matter. If they shut down and aren't able to reopen at some point, what does that do to an economy here in Wayne County that was already a little fragile, coming back, but still was a little fragile?
Well, having been in the commercial printing business for many years and knowing what you have to do every 2 weeks or once a week to make a payroll, and I am very concerned about all of our business, but especially the smaller businesses. And restaurants is a prime example. They've closed those down, and they are fortunate that they are allowed to stay open for the drive-through, but in some cases, we have some restaurants, they don't have a drive-through. So they, and I'm sure, are working something out with their customers of where they can say, well, look, if you drive up on the street here, we'll run a package out to you of food or something on there. And we encourage them to be creative and to think what they can do, because really government can't do anything for them in that particular case. The federal level is looking at loans and making money available. I've looked at that, but I'm thinking they're saying to go through the small business development. I've done that before, and I know how much paperwork there was and how long it took to do that. Now maybe they're going to cut all the red tape out and different things that way, which would certainly be very helpful. We do not have at this time some program in to assist and to help those folks. I would suggest to all of them that you think you're entrepreneurs, you got in that business, I'm sure you can think of ways, how do I keep myself up and functioning? And you pretty much know who your regular customers are so that you can get a hold of them and make sure that your people are safe also, and watch them, take their temperatures, morning, afternoon. I mean, you could not have a temperature this morning, and this afternoon you can have a temperature. I can't emphasize enough, because the doctors have made me a believer in this: soap and wash your hands several times during the day. Keep your counter surfaces and working areas that you're in, that you disinfect those. And now I know the supply is very low, and in some cases there's nothing. But if you listen to distribution experts that they've had on television on there, they'll tell you that we have about a month and a half or 2 months supply of food and supplies and everything that are in the stream already, that if something's out today, by tomorrow they're going to be restocking those shelves. And so people are buying a lot of excess stuff right now. What's going to happen pretty soon, they're going to have a month or 2 months of supply at home. So now they don't need to go, and those shelves are going to be restocked again as they go along. It's difficult, Eric. I wish I had an answer for all my small business people that are out there. Use your ingenuity. You got into this business, you can figure out a way to survive, because the margins are very, very tight. And when your sales go down, that just kills those individual businesses on there. And the part is that we don't know is how long is this going to last. You know, since we got started on this and where we are today, Sunday, our public health people spent most of the day at Reid Hospital. We're in constant contact with them, and a lot of things changed with this individual that we have at Reid Hospital. And as they explained yesterday, it's not a Wayne County person, but also the Reid Hospital is a regional hospital. And so you've got all the surrounding counties and everything that come to Reid, and that's how the individual, I'm sure, ended up at Reid Hospital. Some folks, well, how'd this person get here from Franklin County and Brookville on there? Well, that's my idea of how that person probably got here. And Reid's doing an excellent job with them and has that individual isolated and it's under control on there. We have no Wayne County resident that has certified COVID-19. So at this point, we don't have anybody from Wayne County, but we have those areas of where we have some folks that might be in the pipeline.
Talk a little bit about the function of government and how you all work together. You just mentioned Reid Health is a regional hospital. Mm-hmm. As this would work, as I look at it, I think you all would want some really strong guidance from the state. Mm-hmm. The state would want some really strong guidance from the federal government.
Right.
In the absence of some of that with clarity, everyone seems to kind of be doing their own thing and trying to handle their own people. Well, you all have ERPC, the Eastern Indiana Regional Planning Commission. Right. Our counties around us, particularly those counties that might end up feeding into Reid, mm-hmm. working together to speak in one voice and put into place all of the same guidelines so those things work in a regional area?
I would say at this point, if you take all 92 counties, we are not speaking with one voice. Probably at the moment we're all speaking with some things with the guidance we've received from the state as we're beginning to look at that. But what we are doing through our Indiana Association of Commissioners and our Association of Indiana Counties, we are working with them as they work, and they're collecting data from all of the counties. And this morning I received my first report of all 92 counties that have been reporting into our association with a listing, and we have it in a small Excel spreadsheet as what each of those individual counties are doing. So we're trying to find out, well, what's Eric doing, what's Ken doing, what's Mary doing over here. So, and that is helping us to look at, okay, they're doing that. Hey, I hadn't thought about that. That's a good idea. And what I can see on the list today is we're all pretty much kind of coming to the same conclusion on there. The courts are cutting their jury trials out, and they're looking to have folks call in to find out, okay, your trial has been postponed to a certain time and you do not need to come in. The probation departments are calling their probation people. You will check in by phone or by email instead of coming in to see that. So that cuts those folks out from having to come into like our annex facility here. So we're seeing that, and I'm beginning to see a pattern out there of we're all doing some semblance of the same thing. Like we're taking temperatures here. Some counties are allowing folks in, some have cut them out completely. Some are taking temperatures, some are not. So those are all local decisions, and we're all trying to talk with our public health people, and I'm in constant contact every day with Dr. Jet Moore, our health officer, and with Christine Stinson, who is our executive director of public health, as to what has changed, what do we need to do? Has this been effective? Are we doing the right thing? Just like her advice today is we were trying to say, what about that contract we have at the fairgrounds with somebody coming in? What we have done prior is saying, look, this is what the governor is recommending on here. You know you're going to have this many people. Our advice is you don't hold that. But currently at that time they had a contract, and we said, that's your decision to call. We're now at that juncture where we're pretty much going to say to them, boom, we're not renting this facility, even if you got a signed contract. But we got to check with our legal department to make sure we do all that the right way, legally and everything else, so somebody doesn't turn around and sue us because, hey, we had this and we had advertised and we lost all this funding and so on. So there's a lot of things administrative-wise that we just have to talk about and get in place, because it changes every day.
Talk to the residents who, and you've probably seen it, I don't know how much time you spend on social media, those people who are having a little difficulty with the level of power, control over their individual lives that government is beginning to show. We preach, we're Americans, we're individuals, we have our rights.
Yep.
But right now, the government in certain areas, and you go out to the West Coast, and I know people like to throw stones at the West Coast, but the San Francisco Bay Area has been told, stay home. Shelter in place.
Right.
The mayor of the city of New York has said to his people, within 48 hours, you could get a shelter in place. You're saying there may be more stringent things. Talk to those folks who feel like their rights are being trampled on.
Yeah, I'm not on the social media, okay, and the Facebook, because most of the time, and I have my staff watch that for me, that if something comes up they really feel I need to know about, they let me know and they'll show it to me and I read it. And in the last few days I have seen that where some folks feel, well, you can't tell me to do this and you can't. All I can say to those individuals, what we are doing our best is to keep our population here in Wayne County safe, so that you don't get sick. And I'm sure as much as we do, they're going to continue saying you can't do that, I'm going to go out, I'm going to go do this. I encourage you not to do that. I'm not trying to trample on any of your rights or anything that way. I'm just trying to keep you so you don't get sick. I don't want you to get sick. I don't want you to die. And so we're doing the best we can, and we're asking your cooperation in that. And I'm sure what they've done on the West Coast of New York, of course, but then they've had far more outbreak. We're very fortunate here. We don't have 10, 15, 20, or 30 cases or anything here. So at this point, we can do what we're doing. If we start seeing a trend, then we have to get more, and we just have to ask for your help and your assistance to keep all of us safe on those. And those of you, I hope there's very, very few of those, but you watch it all the time. You can tell me how many are on there, but I'm asking those folks, guys and gals, grandparents, and so on, all of you, we need your help, we need your assistance. Stay at home if you can. Don't go out, go in groups. Don't have your grandchildren come over. You don't want your grandchildren coming over and sitting on Grandpa and Grandpa's lap. You just don't want that. So parents have got to think it's a whole different concept of what's going on now that we're not used to that. If the grandkids come, you want to hug them, you want them to sit on your lap and talk and do all this stuff. But we know people can carry this particular disease and have absolutely no symptoms at all, but be passing it on to you. And you just don't know. So the best thing is not to do those things. So those folks that are over 60 or have other underlying health conditions are more vulnerable to this. And so we have to take precautions that we've never done before. And so we need your help, we need your assistance. I look out there and I say, folks, help yourself. Wash your hands. Wash your hands. Don't the doctors. Wash those hands. Use bar soap. And President Kenyon yesterday pointed out that if they had a run on anything, the run should have been on bar soap because it's more effective than the alcohol is. It's effective when you're out and about because you can do that because you don't have the water and everything. But washing the hands is more effective for a minimum of 20 seconds. Sing happy birthday twice and make sure you do a good job of washing those hands and all over in your thumbs and your fingernails this way and everything so that you're doing that. We need your help and assistance. We don't want that bell curve to go up like that. We want to keep that level down. Then Reid Hospital is well prepared, as you know from the news conference yesterday, and I'm sure you're rerunning that several times for folks to see. They put out a lot of excellent information yesterday in that news conference.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're down to our last few minutes with Commissioner Paust. Greatly appreciate the time. Always enjoy having a chance to talk to you. I know that there's a number of things that you all, over the next couple of days, and you all being the commissioners, the council, the mayor, are going to be going through. Have you had conversations with the sheriff about, and the prosecutor for that matter, about what might potentially happen in the jail if this got into that population, particularly where you're holding people who are maybe in for a low-level drug offense, non-violent? Should we consider letting some of those people go home to their families as opposed to holding them in a confined space with other people?
50% of that I can answer. I've not had any discussion at this point with the prosecutor. I have had discussions with Sheriff, and we have talked, and as you know, we have a contract with a company that provides all of our medical service for our jail population. And I'm sure most of our folks do not realize that we have 24/7 medical care for all the folks that are in confinement in the Wayne County Jail. And they do have a protocol in place for exactly how they're looking at all these situations. I can't go through and tell you what all those protocols are on there. And I'm sure that the sheriff has talked with the prosecutor. I have not, but I'm sure they're looking at all of those things as what they should or couldn't do. And you know, one of the things we have to be very careful about, we have 315 people. That's about what we've been running here recently on a daily population in that confinement area. That if we did a COVID-19 in there, we really wouldn't want to let any of those folks go. They're already quarantined, okay, in that facility. It's how we would care for them within that facility. But we do have everything we need. We have beds for all those folks. We have medical care 24/7 for all those folks. I won't speak for what the protocol is, but I think we could kind of get an idea. They're going to stay confined would be what they're going, but they're going to be well taken care of.
Lastly, talk about, and we've just seen it here this week, 3 states, Illinois, Arizona, and one other I don't remember, held their primary. Governor DeWine over in Ohio had his health director call his off.
Right.
Our primary is still weeks away.
That's correct.
Talk about the availability of absentee ballots, just in case this thing is not happening.
Right.
It is not over by the time our primary happens. People still have their constitutional right to vote.
That's right. And what I would encourage everybody right now, because we don't know, as I said, Dr. Jetmore tells me every 15 minutes the situation changes, and I say, well, it changes every day for us. And so it does. We don't know what's going to happen in May, whether or not we're going to have to cancel that or do it on a limited basis. How would we do that? And we have the vote centers, so with the vote centers, we can concentrate people in an area. Right now, we don't want to do that, you know. So what I would encourage folks to do right now, you can apply for an absentee ballot. So if you're really concerned, apply for that absentee ballot and do it by mail. And I know a lot of businesses, for example, I've had calls from banks, I've had calls from accounting companies. Those are 2 real quickly I can think of. Do you think we should close our lobbies in the bank and only have drive-through on there? And I gave them the best advice that I could do, and I asked questions, well, how many do you have in your lobby at one time? Do you have 1, 2, 20, 30 people? You know, what do you have? And these are the things that we would recommend at this time. If you have that many people, you need to make some changes in there. And what are you doing to protect your bank people, for example, on there? Are you taking temperatures? Do you have material out there for them to disinfect the counters and their work areas and so on like that? And the accounting firm that I talked with, what they're doing, they're not having any of the people come, because now it's tax time. As far as I know, nothing has changed. You still have to have all that in by April the 15th on there. So what this accounting company is doing, they're calling all their clients and having you mail the information into them, and then they're going to mail your tax returns back to you, and they'll electronically send them into the government. So you don't come into the office, so they can keep up and running. Similar to what we're doing government here, of where we're keeping our staff up and healthy and running, but we're just doing business in a different way on here. And I think out of all of this, all of us are going to learn more about how you can work from home. And a lot of people do work from home, and we're looking at all of our departments. We've already had meetings with our staff people to have them look at their office and how can you function from home. And do you need all of them to function from home? Would you need to bring one key people in and send the rest home? And we've talked with our IT department that, okay, what do we have in hand right now, equipment-wise, that if we had to go home and they needed an iPad or they needed a computer, what do we have on hand now that we can take home and set the folks up? Payroll is one of the big things. That's one of the first ones. That's like snow. You got to have that payroll. Well, we have that all worked out in-house as well as in 2 particular homes that if we need to, we can continue to do payroll and people will get paid.
All right.
Yes.
Wayne County Commissioner Ken Paust, I know we're going to have a chance to talk to you as these
Many
next
times.
few weeks go on and as you all make more decisions, and we'll help as best we can continue to get the word out to the community.
Well, thank you very much. I would just say to the folks again, wash your hands, wash your hands, wash your hands. Happy birthday twice. Stay at home if you don't have to go out any place. Don't come down to the city building or the county buildings. Email us. Call us the same way in the court system. We've published all the phone numbers in the paper and everything so that you know you don't have to come here.
All right. Appreciate the
All
time.
right, thank you very much.
We'll be back with more In Focus in just a moment.
Wash your hands and wash them properly. That means a wetting of the hands, applying soap to them, washing them vigorously. You wash in between your hands, and you need to get friction. Friction is actually what is breaking up all of that stuff and getting them off your hands for a good 20 seconds. And if you time 20 seconds, a lot can be said in 20 seconds. And then you rinse your hands thoroughly, dry them thoroughly, use a paper towel to open the doorknob, cover your cough.
Hi, how can I help you?
My daughter has a fever and she isn't feeling well.
Okay, let's get her feeling better.
Receive quality care within the comfort of your own home. Reid Health now, right beside you.
Welcome back to In Focus on Whitewater Community Television's WCTV Channel 11. We've had a chance to move. They let us into Reid Health, and we have a chance to speak with Dr. Thomas Huth, who is Vice President of Medical Affairs here at Reid Health. Thanks for taking some time. I know your days are incredibly busy.
They are.
Talk a little bit about Reid Health and what decisions you all are making as the days go on. Obviously, one day doesn't look like another as you all get more and more information in. And where are you getting your information to help direct some of your decisions?
Well, probably the biggest source of information we have is just our own information coming from our own entry points, our emergency departments, not only the one here in Richmond, but also we have one in Connersville, the types of illnesses that they're seeing. And also we have urgent care buildings across the region, and our own primary care offices particularly. But we also have really strong working relationship with not only the Wayne County Health Department, but also with the Franklin County Health Department, the Fayette County Health Department, and we're looking to establish those strong working relationships with the other health departments because they are at the center focus of their community's interest in trying to get information about what they should be doing. Can they get testing? When should they go to the doctor and that kind of thing. So we're trying to help them navigate those things. But they're sources of information for us as well about the things that are going on. They often are in contact with the state health department where they get some of their information on, how many people are being tested and how many are from their own counties and what they can expect coming up. So it's a little bit like a widespread intelligence net. We're trying to sift all the information we get and factor that into our own planning for how to utilize our resources effectively.
We had a chance to speak with Commissioner Ken Paust a little bit earlier in this program, and I asked him, based on the fact that, because there was a question at the press conference the other day, how did somebody from Franklin County get in here? Well, we know that Reid Health is a regional facility.
Right.
I asked him whether the commissioners and some of the health department people, particularly the government complex, were talking to each other so that they were working off some of the same things. As you move from one county to another with the various health departments, are they all working under the same model and following the same guidelines so that the information you're getting from Wayne County is similar to the information you're getting from Franklin County and that they're looking at the same things?
Well, I've been impressed with the quality and professionalism of the folks at the various health departments, and they all work under a very common rubric that is coordinated by the State Department of Health, and they're following those guidelines very closely. And pretty much when you ask a question of one health department about how they handle things, it's the same answer across all of them, which is good to see. They're being very careful about that. I think the challenge for the health departments is that they're sort of staffed for normal times, and these are not normal times, and they don't have the ability to ramp up their staffing as rapidly as rapidly as we can. As a bigger organization, we can take people from one part of the organization to help out in others, and so we can make those adjustments much more quickly. And so I think that the value of the relationship we have with them is that we can understand their needs and try to help support them, help them gather the information that they need, particularly for those patients who are known or suspected to have COVID-19 who've been in any of our clinics, and we help them with their information needs, and we help them with coordinating information about what we're doing that might impact them. And so one of my big goals is to try to help them be as effective as they can with their limited resources.
One of the topics that's been driving the conversation is testing. Mm-hmm. And the lack of, in some areas, the difficulty for people to get it. What can you tell us about where Reid Health is in their ability to test people who present with something other than what they think are flu symptoms? Do you see that being able to ramp up in this area soon? And I got the feeling from the press conference, and I may be wrong, that you didn't feel testing should be driving the conversation as much as it is. Was I reading something incorrect?
I think from the public's perspective, testing should not be the first thing on people's minds, because it's you have to think about what impact the testing can have for the different scenarios. And for the average person in the community who's not a healthcare worker, and who's not having symptoms, the value of testing is very limited. But I understand people's urge that, hey, if I could just be tested and know whether I've been exposed or whatever, but testing really isn't going to answer that question, unfortunately. The testing is really only the testing that's available now, the way it works, only tells you if something you're sick with now is the COVID. It's not going to tell you from the time that you get exposed until the time you become sick. It may have no value at all of telling you whether you're going to be sick. You can't detect whether you're exposed, in other words,
okay,
from doing a test if you're feeling well. And at the same time, if you've been sick with a cold or a flu-type virus and then you get better, mm-hmm, the testing goes away. The test results become negative again. And so you can't go 3 months out and say, I was sick 3 months ago, maybe that was COVID, can they test me for it? Mm-hmm. It won't detect that. It's not that kind of a test. The test, actually, what it does is it tests for the viral RNA, and that's a big concept that we're not used to thinking about with testing probably longer than 5 or 10 years ago. The typical test for something like influenza or some other illness was an antibody test, which is something your immune system develops after you've been exposed to a pathogen of some type. And that may persist for a long time even after you get well. So for instance, let's just take an example, hepatitis B. Typically when we test for that, it's an antibody test that tells us whether you've ever been exposed in the past. And certain types of antibodies tend to rise and go away. And so, there are actually multiple antibodies that can be tested for in that case. And depending on the pattern, you can get a sense for how recent that exposure might have been. That doesn't work that way for the COVID test. This is an RNA test that essentially detects active virus in the system once it reaches a certain level to cause symptoms. And so that's the way viruses are constructed. They have a central core of genetic material, and a part of that genetic material are proteins that are called ribonucleic acids, RNA. And it's the breakdown of that RNA as the body begins to fight off the infection that is detected by the test. But that gets cleared and goes away. So there's just a short window during which the test will be positive, and usually that's only typically in the context of an acute illness. That's what we know for sure. How much outside of that window can be detected with the test is not clear. And furthermore, what's the value of it particularly from the individual person's standpoint? Mm-hmm. If I test positive but I'm feeling well, there really isn't anything much for me to do except to isolate myself for 14 days to ensure that I'm not actively shedding virus, potentially. But the problem is the testing capabilities are extremely limited at the moment. And, you can get into a lot of reasons why. I don't understand all the reasons why. There have been other countries in the world that have had much more access to testing. That's not the case in the U.S. for reasons that are above my pay grade. All we know is that within the state of Indiana, there is very limited ability to access testing, and so it has to be carefully utilized so that it's targeted to the highest impact situations. And right now, that is typically limited to very sick patients who need hospitalization so that the caregivers can sort out who really has COVID from maybe other conditions. And that is important to us because if we can verify that they do not have COVID, then we can take them out of some of the isolation and situations that we have them in, and relieve our caregivers of having to work in protective equipment. So that's really the big value to us. Otherwise, it doesn't necessarily impact the treatment so much because the treatment for it is supportive, which we're going to do whether we have a test result or not. And so maybe in the future this will change, and maybe in the reasonably near future. But I'm not in a position to really estimate when that's going to change. I think it may be sooner than what people kind of fear, because I know that there are commercial companies that are developing their own forms of testing. And we've heard about one this morning that from a company that actually has a rapid test that can turn around a result in a few hours, kind of more like the turnaround we get with influenza testing. That will be super useful to us. And if it becomes widely available at a really good price, at a low price, it may be something that could be more accessible, like say on a drive-through basis. Some organizations are trying to do that now.
I've seen that on both coasts.
Yeah, absolutely. And now when you shift the perspective to sort of the scientific epidemiologic overview, it would be super useful to know how widespread in the community
Right.
COVID is or has been. And we know that there are countries, the two that are most commonly mentioned are South Korea and Taiwan, that have really put a lot of drive into testing as many people, sick or well, doesn't matter. They have drive-throughs set up on the corners. They encourage people to come in and get tested. And that's very helpful from an epidemiologic standpoint, like say the public health authorities, from knowing who are potential contacts and potential transmitters so that they can be managed from an infection control and public health standpoint and limit their exposure to other people, because theoretically, if you're still testing positive for the COVID, then you may be contagious to other people. So I guess we have to kind of understand the perspective that we're talking about, the utility of testing. And there's really three. There's how important is it to the individual to know that whether they've got COVID, and it can be important. I mean, I think I might be interested to know if we get to the point where the test is really available, it's not limited, it's reasonable cost. Heck, maybe I'd get tested too. But I'm not worried about that from my own standpoint or the health of my family, because I know that it's not going to really impact our health. Then you shift to the perspective of the healthcare provider, like we are, where we have to make decisions on how we're going to take care of people based on the things we can determine for their risk for COVID. And without a test, we're limited to sort of more probabilities than certainties about a situation. And when there's probabilities, when you have only the probability that when we have certain constellation of symptoms and signs and so forth, they're likely to have COVID, and if they don't have a certain amount of those signs and symptoms, they're unlikely to have COVID. That means we're going to maybe, not always make what turns out to be in the end the correct decision about whether someone has COVID or not and should be handled in certain ways from an infection control standpoint. So we would really, really value having large quantities of testing made available to us, even if it's not super inexpensive. Even if it costs, $50 or $100 or $150, we would do that. We would utilize it more broadly amongst our patients, just so that we can rapidly make decisions about their care. That would be a very wise investment on our part. But that capability is not there right now. Then you got the third perspective, which is a public health perspective, and widespread testing really would be good from a public health perspective to have. We're not there on any of that, but I think that it's in the reasonably foreseeable future that there will be, because so many companies are working really hard to make those capabilities available. As it stands today, the State Department of Health has very limited testing. They have to target it to the highest risk, highest value situations. So they are limiting that to people who have severe symptoms, who the results will help the caregivers make decisions about how to manage them going forward. That's just where we are today. And we get turned down for some of the cases where we are proposing to test, because they have criteria that they go by.
Who's turning you down? Is it the State Department of Health?
When we have a case that we think could qualify, the standard process is that we contact the State Department of Health, have a discussion with one of their epidemiologists who make the final decision on whether they're going to authorize testing for that individual. And we don't get that authorization in every case. Now, we get it in a lot, but not every one. And that's just where they're at. It's not anybody's fault. It's the way things work today. But at the end of the day, people are still going to get the care they need. It's just that we become encumbered if we can't sort those out. Now, actually, if the state says they don't need to be tested, there's a high probability that they're not actually a COVID candidate. And so we have to make a decision internally, do we agree with that or not? And we may step down what we're doing as far as the isolation, isolation guidelines and so forth, or sometimes we can, we have in the last couple of days had some ability to get a private company test done, but they are also limited, so that's not a complete solution as it is.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're down to our last couple of minutes with Dr. Huth, and I really do appreciate you giving us some time. Let's try to walk away from this with providing some basic information for people, because you talked about isolation or quarantine. Mm-hmm. We've heard that a lot. We want people to quarantine themselves. They come in from overseas or wherever. Quarantine yourself for 14 days. Okay, you're living in a one-bedroom apartment. There's 2 or 3 of you sharing, and we know students have this and things of that nature. Talk to people about when we say quarantine or isolate, what that seriously looks like in a home. If I am not feeling well, do I wash my own dishes? Do I let someone else handle that? What is the safest way for people to react within the confines of their home to cut down on the risk of spread?
And that's a great question, and we tell people self-quarantine for 14 days, but we don't tell them very much about what that means in practice. And so, and I had this conversation just this morning with the Wayne County Health Department leaders, and I think we may see some guidance that they'll publish on what they expect to see when people are asked to self-quarantine versus isolate versus what's social distancing, and how do those interact. And also, how do you comply with the county's level 2 travel emergency order? So I think we'll see some of that guidance from them in the coming days. But I think I would probably boil it down to this: if you've been asked to quarantine because you're an actual or potential contact with a COVID patient, what that means is not necessarily that you're confined to the 4 walls of your home and can't step outside. We've had that question. Can I at least walk outside? Sure. Yes, of course you can. Can I get in the car and drive around the block? Yes, you can. But the important thing is you're not traveling around doing, interacting significantly with neighbors and friends and so forth. And those people need to be in a relatively confined place, location, and people not spend significant time within about 6 feet of you. 6 feet is the rule that people apply. So you can go outside. You can walk around the house. You can even get in your car and drive maybe around the block if you just got to. Now, we don't want you wandering around the town but staying in your car. That's not the intent of this. The intent is to stay close to home. But you ask questions about, can I wash my own dishes? Absolutely. You do everything in your house that you normally do today, including prepare meals for yourself and your family, because they're going to be with you. You all are in the same boat, so they're really within the house. There really isn't a restriction except that other people shouldn't be coming in and visiting and so forth. Okay. You can do the internet, watch TV, talk on the phone. Sounds crazy to mention those, but we've had those questions. Because we're not very good at giving people instruction about what this means exactly, and they want to make sure they're doing what they should.
And that's part of the reason for the question.
Absolutely.
Sure.
Now, and self-isolating really is kind of a synonym for that. In my understanding of the county travel order is that we should be doing essential activities only. You can go get gas for your car. You can go to the grocery store. You can go to the doctor. If you've absolutely got to do some banking, go do that banking. They're probably going to provide a way for you to do that without coming in the building, I would suspect.
Yes.
You can get food. We all have to eat. And people who work really essential kind of jobs should go to work. But if your job is a non-essential job, then you go by what your employer says. And I know that there are businesses that have basically closed down. I think the library in Richmond is closed as an example because they're trying to help people comply with the travel ban. But on the other hand, there are jobs where people need to go and do them. And it's not just healthcare. The police and the fire have got to go do their job. those are essential services for
Buildings
sure.
don't clean themselves.
Absolutely, and I would say even manufacturing jobs, because we still got to put out the product, and that we can't make the entire economy come to a halt. If those jobs can be done safely, then my view is, those employers should be making rational decisions about the essentiality of people and asking some just to maybe stay home or work at home if they're able. But there are some things that need to happen in that building. And just as an example, I know that there are companies that have manufacturing processes that you can't just send people home and walk away. They have furnaces that have to be tended, that if you turn them off, it takes weeks to bring them back online. They can't just do that. And so they have basically at least skeleton crews of people who've got to maintain things so that they can be used. And every company has got to make those determinations for themselves, and but should intend to act responsibly for the community's benefit.
Is this more about cleaning up behind yourself, disinfecting, making sure that you're wiping things up than it is about staying away? In those instances that you're talking about?
I think when we're in self-quarantining, there is a physical barrier, distancing kind of aspect to that. We should be close to one location, and we should be physically distant from other people. But still, good hygiene in the home. Let's say we've got 2 or 3 person family who are quarantined together at home. One of them has a respiratory illness, may or may not have been tested for COVID, because they aren't necessarily going to be tested as long as they're not seriously ill. They're probably not going to be tested, actually. But the others in the home are still healthy. They should observe good hygiene practices in the home. Maybe that individual should not be preparing the meals. Everybody needs to be washing hands very frequently. And I think we've learned that washing is preferable to hand sanitizer use, but if you don't have anything else, hand sanitizer at least is something. There is something about the chemistry of soap as opposed to the hand sanitizer that in this case seems maybe as effective and possibly more effective at more rapidly killing the virus than hand sanitizer alone. So we are recommending widely people focus on washing with soap and water for 20 seconds. Variety of ways to do that. You can simply count to 20, or some people will sing to themselves the happy birthday song, or there are other ditties or whatever sayings that people will do and repeat to themselves. But it's the lathering action for a particular period of time, minimum period of time, that seems to work best. That's a good general hygiene practice that has been in place for a long, long time. In this case, seems to be particularly important.
Dr. Huth, you've been incredibly generous with your time. I know
My pleasure.
You've got things to do, meetings to attend, and I appreciate the time.
My pleasure. Thank you for coming.
Thank you. Thanks for watching this episode of In Focus on Whitewater Community Television's WCTV Channel 11. Normally during this time of year, our In Focus programs would be our In Focus candidate forums. Our Thursday evening gatherings would be focused on the upcoming election, and we'd be hearing thoughts from those wanting to be political leaders in our county, our state, and our nation. Trust me when I tell you, I'd rather be having those conversations than the ones we're having right now. But as more restrictions on travel and gathering continue to be placed on our lives, it looks like we are not going to be able to provide that service in this space. It's a service that we've been providing since In Focus was PI Live. But there is a primary election coming up, and we, Whitewater Community Television, and our partners in the In Focus candidate forums, the Wayne County Area Chamber of Commerce and Hometown Media Group, do encourage you to be registered to vote. You still have until April 6th to do that, and you can do it online at indianavoters.com. In the past, local media has sent questions to candidates in contested races to elicit answers. And if they do that this primary season, we'll point you toward that information. While we hope that this will all be over by the time the primary election, which is scheduled for May 5th, comes around, you should consider planning ahead and reaching out to the clerk's office for an absentee ballot. We'll try to reach out to Wayne County Clerk Debbie Berry to gather and provide some information on absentee voting to those who have never voted that way. You can also find information on the Wayne County Clerk's website. Some of the information that you heard during this program was actually recorded yesterday on Wednesday, so it may be out of date, particularly as the Wayne County Health Department has announced the first presumptive positive COVID-19 case of a Wayne County resident. A couple of other things that you should be aware of. WCTV's annual Casino Night fundraiser, 21 for Fun, has been postponed. It was scheduled for Friday, April 17th. Remember, I said postponed, not canceled. We are looking at a rescheduled date, and we hope to be able to announce that next week. Whitewater Community Television's family of stations, WCTV Channel 21, WETV Channel 20, and this one, WGTV Channel 11, are also feeling the restrictions that have been placed on the community. We're trying to provide information to the community on air as well as online. Obviously, much of what we've been presenting here on WGTV Channel 11 is government and health related. When you tire of that, please feel free to check out our other channels. WETV Channel 20 has programs on business, veterans affairs, cooking, and even some public domain movies. Our programming on Channel 21, WCTV, has taken a hit and will continue to, particularly as our area churches heed the call for social distancing and end up canceling services. As that continues, we'll reach into our archive of past programs and present reruns and programming from past years. Tune in. I'm sure you'll see some familiar faces. But as programming continues and we reach further into our archive, we are also trying to find some new programming for you. We recently had a chance to record the Purdue Glee Club and Singing Hoosiers at Civic Hall Performing Arts Center. That will air this weekend. We're also in the process of trying to edit the U.S. Army Band concert that, again, was recently held at Civic Hall Performing Arts Center. We recently updated some equipment in our server room, and our normal location for government meetings, WGTV Online, is not currently functioning. This program, In Focus, along with our government meetings, can now be found on our YouTube channel. And you'll be seeing a slide about information on how to reach out to us on YouTube, Facebook, Instagram, and Twitter. Whitewater Community Television is just that, community television, and we want this to be a two-way conversation. So if there are questions that you want us to ask our mayor, our commissioners, our health professionals as we have a chance to travel around the community, please do that. We are, like everyone else, social distancing, so we are working part-time here in the office, most of the time at home. You can leave us a message, you can send us an email, and we will respond to you as quickly as we possibly can. My time is up. This show is up. So once again, as I normally do, I wish you well. Thanks for watching. Take care.